A lot of changes with healthcare, from going to the doctor through telehealth to limited visitors being allowed and postponing surgeries. One aspect of healthcare that has grown is the importance of the air ambulance. For that story, we go to KMVT's Elizabeth Hadley, who's standing by live in the newsroom. Elizabeth.
Thanks, Joe. The air ambulance provider Life Flight Network has filled a critical role during the COVID-19 pandemic, especially for rural hospitals. It takes 6 minutes for a Life Flight helicopter to get from the Burley Airport to Minidoka Memorial Hospital, and those 6 minutes can be crucial.
We can have heart attacks, STEMIs that need to go to the cath lab and get their heart vessel opened up, strokes, burns, traumas, severe COVIDs that are intubated need to be transferred.
Like many rural hospitals, Minidoka Memorial works tirelessly to help the community with their health needs. But with the high number of COVID-19 patients and staff testing positive, the critical patients need to be treated somewhere else.
It is not uncommon for us to depend on air ambulance, Life Flight, or Air St. Luke's, and really to help get these patients transported rapidly to where they can be benefited with a higher level of care.
The helicopter acts like an ICU room in a hospital. It has all of the necessary equipment and tools to keep the patient alive until they land on the ground.
You know, it's just all smaller and compact. We carry quite a good pharmacy with us that we have access to for all sorts of medications. We have, advanced cardiac support, ventilators, to breathe for somebody. So we truly are an ICU in the air.
If the patient is COVID-19 positive or has symptoms of COVID-19, they will wear all the proper PPE while in the helicopter, which they didn't have to do before the beginning of the pandemic.
You have to, completely clean everything that potentially could have had any exposure. So the entire inside of the helicopter, all of the equipment, anything that could have been exposed has to be cleaned between, before you can take another one.
The air ambulance has been a critical component in helping patients during this time, transferring them to a different facility and keeping them stable along the way.
We are a pivotal partner with these small facilities to help them get patients from, one spot to another.
Now, both Dr. Mills and Tim Beard remind the community to remain vigilant and careful. The COVID-19 pandemic isn't over yet. Live in the newsroom, Elizabeth Hadley, KMVT News.
All right.